Welcome to the Adoption and Foster Care Journey, a podcast to encourage, educate, and equip you to care for children and youth through adoption, foster, and kinship care. Hosted by an adoptive mom with over 22 years of kinship and adoptive parenting experience. She's on this journey with you. Please welcome Sandra Flack.
And he, Jesus, awoke and rebuked the wind and said to the sea, "Peace, be still." And the wind ceased, and there was a great calm. That is Mark 4:39. I'm your host, Sandra Flack. Welcome to the Adoption and Foster Care Journey, where I am here to encourage and equip you as a mom of 8, 5 through adoption, all with trauma, including 2 young adult sons, both diagnosed with fetal alcohol syndrome when they were little and are now in their 20s. I too navigate the challenges of raising children with trauma histories and prenatal substance exposure. My hope is that you will find this podcast to be an invaluable resource for your parenting journey. This week, I am thrilled to have back our favorite returning guest, Dr. Jerrod Brown. But before we begin with our conversation with Dr. Brown, few notes here. Listen to what readers are saying about my new devotional book, Soul Care Saturday, 52 Devotions for Foster and Adoptive Moms. Tracy writes, "I love Christian devotions, but sometimes it's hard to relate, and it's easy to feel alone when your life has so many challenges from the trauma of adoption and special needs." As a mom of 12, 6 of whom were adopted internationally, I'm so thankful for Sandra's insights from her own journey. I can relate to her personal stories. I'm so encouraged by the truths from God's Word that she shares, which remind me of the reason we adopted. So, Soul Care Saturday is now available on Amazon, of course, and you can go over there and grab your copy today. And if you do, and you love it like Tracy does, please go back onto Amazon and leave a review like Tracy did. I would greatly appreciate that. Now, my next online webinar is coming up in September. I am taking July off and August off of doing online training. July a little bit because I have a daughter getting married and we have family coming in from out of town and staying with us. And then when that is all said and done, we have our retreat. I have several moms coming in from all around the country who are staying up here in the Adirondack Mountains with us for several days for our our Hope for the FASD Journey online support community. We are doing our first ever retreat. So I'll be having ladies come in. There's going to be about 13 of us. So we've got a lot going on in July. And I have a very busy travel and speaking schedule for the fall. So August is really going to be a time of rest and renewal for me and get some writing done and some planning for those things in the fall. So there will not be an online workshop until September. But what it's going to be is Wednesday, September 16th at 10 a.m. Eastern Time. I'm offering Wired Differently, which is a 3-hour online workshop for parents, caregivers, and professionals. We'll be focusing on the impact of trauma and prenatal exposure to alcohol on the brain and body. In this workshop, we unpack the primary, secondary, and tertiary symptoms of brain-based differences, including FASD, but not just limited to FASD. And we explore accommodations and strengths-based strategies for supporting children, teens, and young adults. So there's a link in the show notes where you can go and sign up for that course in September. It's just a one day, 3-hour session. And I know that you will find it invaluable for your parenting journey. So also would love to connect with you in person in the fall. Like I mentioned, my traveling schedule, my speaking schedule. In September, I will be at the Christian Alliance for Orphans in Atlanta for the annual summit there. That's September 23rd through 25th. I will be leading a coaching room. So especially if you are raising kiddos with prenatal substance exposure, come see me for that coaching room. And then I will also be doing a meetup where they will give us a room, and anybody who's in that space would like to come and connect. I'll be connecting with you, connecting with each other, and then I will be praying for everybody who comes. So if you're coming to CAFO, find me there. I'll also have a booth in the exhibitor hall. And then I will be at Replanted in Chicago, October 15th through 17th, where I will be doing 3 breakout sessions and have an exhibitor booth. So find me there. We could take a selfie together, hang out a little bit. I always love to connect with my audience in person. And if you would like to have me come for your conference or retreat, or if you want to just do a special online session for your support group, whatever. I'm flexible and I'm open. If you're interested, my email address is in the show notes. You can contact me directly, Sandra Flack at justicefororphansny.org, and I will respond and we can get something on the calendar. So, and you'll want to go to our website anyway, justicefororphansny.org. Click on the homepage, click on the adoption and foster care journey, and you'll find all of our resources there for foster and adoptive parents and kinship caregivers, from not just special episodes of this podcast, my blog, all of the online workshops, FASD parent coaching that you can register for, all kinds of things there, the support group. So you want to check that out. So now that all the, I guess you would call that housekeeping, is done, let's get to our guest. Today we have Dr. Brown, Dr. Jerrod Brown, back with us to share on the topic of migraines and adverse childhood experiences. So as a reminder, Dr. Brown will be using a PowerPoint. So if you want to see his slides, you can go over to the Justice for Orphans YouTube channel, where all of our podcasts exist. If you want to watch your podcast, you can go there. But if you want to see his slide deck for this presentation, you can see it there on our YouTube channel. So that's the Justice for Orphans YouTube channel. And you can watch that there. I highly recommend that you do that. So just a little bit about Dr. Brown. If you're not familiar with him, he has like 5 PhDs and specializes in topics related to autism spectrum disorder, fetal alcohol spectrum disorder, confabulation, suggestibility, trauma, and other life adversities, alexithymia, executive dysfunction, criminal recidivism, traumatic brain injury, and youth fire setting. You can check out his full bio, which is on our website, along with dozens of other bonus episodes that we have recorded featuring Dr. Brown, vital topics for every foster and adoptive parent to know about. Those are actually, they're all, you can scroll through wherever you listen to your podcast, but you'd have to go quite a ways back. All of our episodes with Dr. Brown are actually also housed on our website, making it super easy for you to find them. So let us dive in. Please welcome back Dr. Jerrod Brown. Hey, Jerrod, welcome back to the show.
Thank you, Sandra. So glad to be here. And yeah, it's been a little while, my friend.
I know it's been a little while. I didn't realize how long it had been. So I was like, we got to get Dr. Brown back on. We love having you on a regular basis. So we'll get back into it here. Our audience always loves to hear from you. You bring so much expertise and excellent content to the podcast. So I'm really interested in today's topic, migraines and adverse childhood experiences. So I'm sure our listeners will benefit from our conversation, whether their child suffers from migraines or even maybe perhaps themselves. So I'm going to hand it over to you and you can dive right into the topic.
Yeah, thanks, Sandra, again for having me back. Hi, folks. Hope all of you are doing well. So if you're listening to this and you want to see this visually, I have slides here. I put together a presentation because there's a lot of moving parts with this topic. And migraine, some people ask, well, why are you doing a talk on migraine? Well, I've been studying this topic more and more over the last few years. In one of my degree programs, I have one of my master's is in nutrition. I spent a lot of work on the topic of migraine in that program through a nutrition lens. And my colleagues actually and I wrote an article you can find on the national level. I think published it probably within the last 6 to 9 months, looking at migraine through a behavioral health lens, because Also, often when you think of migraine, you only think like only a medical doctor can handle this, which obviously medical doctors play a huge role. But you're going to walk away hopefully today realizing, well, a mental health provider can help with this. Exercise, nutrition, sleep, gut health, all kinds of things. And if you are raising a child who's had a lot of trauma, adversity, hardship, attachment issues, FASD, autism, ADHD, prenatal exposures, the research is very clear in this. You're raising children that have higher rates of migraine compared to children who do not. And as Sandra alluded, maybe you as a caregiver are dealing with migraine, and migraine is very, very common. And it's even more common when we're talking stress and burnout and all those things. So that's why I'm doing this talk today. And here's a copy of my brief professional biography. I have a PhD, 6 masters, lots of different certifications, go on lots of podcasts, do a ton of work in the area of autism, FASD, ADHD, brain injuries. And now I'm really trying to infuse all the things I've done in these areas with sleep health and exercise and chronic health conditions and all of the other things that unfortunately frequently all come up way too common when we're talking about raising children that have had a lot of not so good stuff happen to them early in childhood or maybe before they were even born. So here are some of my main areas of focus, expertise. We'll talk about some of these today. So if you see this visually, definitely reach out if you have any questions. So agenda day, pretty straightforward. Give you a broad spectrum overview of migraine and trauma. Part 2, how do you implement this, is being more practical. And then part 3, lots, tips, strategies, solutions, interventions. And I'm not giving any medical advice here. It's just general education. Talk to your healthcare providers, but I believe education and alerting people to what the research says on this is an intervention because it's empowering. And then you can go to the right providers and hopefully piece together a multidisciplinary team to maybe address migraine. Because if your child is dealing with migraine and no one's ever really considered that, that impacts your child's attention, learning, memory, their energy, how they interact with you and the family. So migraine, I think we all probably know what it is, but I just want to show us visually here. Again, why do we want to care about this? Well, what are some of the most leading causes of disability in the world, according to research? Chronic pain issues, depression, migraine. These are some of the big 3 at the top of the list. So you're asking yourself, well, what is a migraine? Well, it has been referred to as a complex neurological disorder. The research is very clear on this too. In a lot of cases, when someone's dealing with a migraine, it's underdiagnosed, it's undertreated, it's not on the radar of a lot of professionals. And this goes up even more when we're talking about kids diagnosed with FASD, other kinds of neurodevelopmental disorders. How often is this considered when you're raising a child that has one of those diagnoses? And I've been working in the area of FASD for a long time now. And brutally honest, up until the last few years, I never really thought about migraine. I wish I did, because looking back on it, it's another piece of this puzzle that we need to really dig into and help that person maybe address some of these issues that could make them more prone to migraine severity. So if you see this here at the bottom of each of my slides, if you're a nerd like me, you're into research, well, there's good articles here that most of these come from peer-reviewed journals. So migraine is a significant public health issue. I'd also say it is a medical issue, a clinical issue. It is an educational issue. If that child is going to school and has a migraine, that child in the classroom could present as having a lot of behavioral control problems, where maybe it's driven by an undiagnosed, untreated migraine in some cases. So if you look at this research, a lot packed in here, migraine has significant implications for overall quality of life. So when a migraine goes unaddressed, unmanaged, untreated, it absolutely can increase depression, anxiety, medication overuse in some cases. Now, I'm not trying to scare anybody here, but there's plenty of studies that do show that in some cases, dealing with migraine for a long, long time may increase the risk of suicidal thinking in some people. So migraine, it's not just a headache. There's a lot more to it. It is a headache on steroids, and there's all kinds of other symptoms you want to be aware of. And if you see this here, around 1 billion people worldwide deal with migraine. I've seen research studies say that migraine is the second leading cause of disability in the world. I've seen other studies say it's the sixth leading cause. So whatever it is, it's definitely in the top 10. So looking at this here, what about migraine in the United States? Well, it impacts around 1 in 6 adults. And this is a few years old now, so this number is probably higher, but at that time, that's about 32 million adults living with migraine. Men and women, differences definitely in migraine, looking at gender considerations, all of those factors. I don't know where this number would fall, but I do suspect if you are in a family system and there's tons of stress, financial stress, if there's housing instability, poverty, someone's losing a job, and the more stress that's going on in that family system, stress is a big driver for migraine. So if you look at those prevalence rates I showed you on the 2 slides ago, if you look at that rate of 1 billion people, how does this get broken down into? Well, depending on the study you look at, around 9 to 18% of people worldwide deal with migraine. That number is astronomically higher. I mean, if you look at the rates of FASD in the general population, 1 in 5, autism's about 1 in 33 now, schizophrenia is 1% of the population. I mean, the list goes on. The rates of migraine are significantly higher than all of these disorders that we all know too much about. And look at this. Why are we doing this talk? Here's another reason. Well, there's not a lot of training out there and awareness, especially outside the medical community. How often has a caregiver ever had a talk or a training on migraine? Probably not that often. How many times has a mental health provider had an in-depth training in migraine? In my experience, it's just not taught in those programs. So if you look at this here, and depending on the study, around 70% of patients with migraine don't seek medical advice. There's a lot of reasons for this. Under awareness, sometimes there's stigma, sometimes there's confusion. So what is a migraine again? It's a recurrent headache disorder. Typically, the duration is around 4 to 72 hours. And looking at the diagnostic criteria, again, a migraine would only be diagnosed by a qualified medical doctor. A mental health therapist is not going to diagnose a migraine, but a mental health therapist it would be invaluable for them to know the symptoms, red flag indicators, where they can then refer out. So migraine needs to be for a period of at least 3 months, more than 15 days per month. The headaches characterize more than half the episodes. So we'll break this down a little bit further so it makes a little more sense. And Sandra, I'll stop in just a second. So this here, it gets complicated. There's different subtypes of migraines. We don't have time to get into all the subtypes, but these phases are kind of the big phases of a migraine. And not everybody that has a migraine is going to start out in these phases and work their way through. It can bounce around a little bit, but this first one here, the prodromal, this is kind of that pre-headache phase. The duration of the headache may last a few hours to several days. You might see symptoms of more depression, irritability here. It can actually impact digestive health as well. The aura stage, you might see more visual disturbances. So someone has more sensory changes. They might flashing lights, things like that. We all know what a headache is. Again, migraine, headache go hand in hand, but a migraine, there's other symptoms and the severity is typically more intense. And then this here, if you see this, folks, this post-stromal stage, this has been referred to as the recovery phase. This is typically when the individual, after they go through these stages, is probably going to be exhausted. lots of fatigue, probably some concentration issues. They might have some lingering head pain. They could be dealing with more dizziness as well. So, Sandra, I'll stop there if you have any thoughts, questions.
Oh my goodness, so many things are swirling around. So I'm sure some of them will be more applicable as you go on. But a couple of things that I'm thinking of is in our population of kids through adoption and foster care, you know, and maybe this is more of a just an out loud thought. But for example, one of my boys adopted from he spent all 5 years of his life in an orphanage, and our kids typically they're not getting their needs met, so they stop expressing that they have a need, that they have pain. One of, my little guy, I think we weren't even home a year and he woke up one morning with an infected tooth. Like it looked like he had a golf ball stuffed inside of his cheek. There was this
Yeah.
swelling and he'd never once complained about that pain. I had no idea he was suffering from an infected tooth until I saw that. So I think that can be common where kids in these spaces have a very high pain tolerance. So we could have children suffering, could we have children suffering from migraines and we don't even really know that that's what's going on, but it's they're suffering and they're not saying anything. Maybe it's even become normal to them to have that pain, but yet of course it affects everything else, their behaviors, their mood, their sleep, their everything. Could our kids be suffering from a migraine and we not know?
100% yes. Yep. I'm actually putting together a talk right now for a different group, really digging into how does migraine present in autism? And there's some interesting research that it does present differently. And maybe the person isn't able to articulate that because of alexithymia. Maybe the pain receptors are different and the presentation's different. So you really got to understand the nuances there. And if, Sandra, your audience, you find this helpful, I'm more than happy to come back and talk about the nuances on how this could present in someone with autism or ADHD or a head injury different than someone that doesn't have those conditions. So the answer is yes, it could absolutely be a factor. And if you are noticing all kinds of just behavioral changes, eating pattern changes, the person maybe it's complaining, oh, my head hurts sometimes, but it's more acting out behaviors. I'm not saying it's a migraine, but it doesn't hurt to talk to a doctor and like dig deeper. Could there be something going on? And if we know, this is a great segue into this slide here. If you see this, we know that prenatal alcohol exposure, drug exposure, tobacco exposure, malnutrition, lots of trauma can change brain chemistries, brain structure, hormones, neurotransmitters. Well, this stuff here gets deep in the weeds with neurobiological mechanisms, biochemical things. And when the body is out of balance, out of homeostasis, connections in the brain aren't working properly. So this cortical spreading depression, basically what this is, it's going to be some electrical changes in the brain, maybe some blood flow changes. There's plenty of good research out there on FASD and neuroinflammation. Neuroinflammation, the brain is more inflamed, the brain stem. A lot of good research out there on oxidative stress. This is an imbalance between free radicals in the body and antioxidants. This here, this trigeminal circuit system, this is something your audience would definitely want to be aware of. And then vascular dysfunction. These are some big topics to be aware of. Lots of trauma, prenatal adversity, hardship, neglect can throw off the brain's chemistry and circuitry and contribute to a lot of these things. So looking at this here again, there's a lot of factors that may contribute to migraine. It's not one factor. Maybe there's some genetic factors involved. Absolutely. What about environmental influences? Again, what kind of environment does that child live in? Is it a very chaotic home environment? Are they at school getting bullied and teased? Is that child allowed to be up all night long and watch whatever they want? Can they drink energy drinks all day long? So the environment has a lot to do with this. There's all kinds of other things here I wish we had more time to get into, but like mitochondrial disturbances, this goes to the heart of cellular energy. So if someone, how do you combat some of these things? Well, easier said than done, but living a good lifestyle, balanced lifestyle, getting lab work, working with the right providers, even working with functional medicine providers can play a role here too. Very high percentage of people that deal with migraine are not just dealing with migraine. There might be some co-occurring conditions. And if you work with folks on the autism spectrum, you work with folks with bipolar disorder, multiple sclerosis, different chronic sleep issues, rates of migraine are higher in these populations. Even obesity and insulin resistance, metabolic issues, comorbidities of migraine are more common. Not everybody with these diagnoses here are going to have migraine, but the research does say if somebody has one of these diagnoses here, the rates of migraine are higher compared to the general population. So depression, anxiety, fibromyalgia, sleep issues, irritable bowel syndrome, and various cognitive complaints like executive dysfunction, metacognitive impairments, things of that nature. Breaking it down a little bit further, here's another study. So maybe somebody you know has multiple sclerosis, epilepsy, stroke history, post-traumatic stress disorder, migraine are higher in these populations. Not everybody with these diagnoses, again, are going to have migraine, but the rates are higher in folks with these diagnoses. So in pediatric populations, you're asking yourself, well, what are the rates of migraine in just general pediatric practice? Well, some studies say around close to 8% of children and adolescents have a history of migraine. This number is probably higher when we're talking kids with trauma, neurodivergent kinds of disorders, things of that nature. This is a really lovely article published last year in 2025 that talks about when we're talking about pediatric migraine, what could be some factors involved? It's not going to be any one factor. It's probably a combination. High levels of adverse childhood experiences. Maybe mom or dad has a lot of mental health problems going on themselves. Maybe it's a parent who is extremely controlling of their child. That might be a factor in some cases. Poor family support, emotional dysregulation problems, stress, all these things. The more of these going on, it's not good for the brain and body. So if any of you are into neuroscience, what could be going on in the brain from a neuroscience lens? Well, we talked about this briefly before, so it could be some mitochondrial dysfunction, so problems at the cellular level with energy, more neural inflammation. Maybe there's some changes or reductions in the gray matter volume in the brain. There's some good FASD literature on white and gray matter volume disturbances when we're talking prenatal alcohol exposure. An impaired brain glucose metabolism, which basically means the brain is not metabolizing glucose in the bloodstream. Glucose is the fuel for the brain. Where does glucose come from? Well, carbohydrates, sugar, things like that. So you don't want to have too much and you don't want to have not enough. So skipping meals, never eating breakfast can throw this off as well. Autonomic nervous system dysfunction. I think we did a talk on that, Sandra, in the past.
Yes.
Very common among kids exposed prenatally. Well, migraine and autonomic nervous system dysfunction go hand in hand. When somebody has autonomic nervous system dysfunction in the brain and a co-occurring migraine, you might have more nausea going on. The person might be more sensitive to light, odor, and sound. HPA axis. I know we did a talk on this in the past. Plenty of research on prenatal exposure, trauma, adversity, and HPA axis dysfunction, which is basically the hypothalamus pituitary adrenal axis. It is the human body's main stress response system. It's a hormone regulator. When this system is out of whack and not working properly, it throws off all kinds of systems in the human body. Well, if somebody has a history of migraine, plenty of research shows that the HPA axis is also not in balance. So when you have somebody with a migraine, Maybe they've got a lot of stress going on. What can happen? Well, we got the autonomic nervous system not working properly. We have the HPA axis not working properly. Then it trickles down. In some cases, the person might be more likely to have panic attacks, gut health issues, constipation, diarrhea, bloating, more dizziness, and it can trigger more migraines. Maybe mom is pregnant and has a history of migraine. Well, there's some good research out there on that too. Another variable that we need to consider. So maybe you adopted a child who was exposed prenatally, but also mom maybe had a long history of migraine throughout pregnancy. That can play a role in maybe some different complications. And I don't want to alarm anybody. Every situation's different, but if you see this slide, here's different variables that have been looked at in different studies. Maybe mom was using tobacco or alcohol during pregnancy. We have research literature that does support the fact that these two variables in and of itself could contribute to that child after being born to be dealing with more headaches, unfortunately. Just another study that does talk about we need to be aware was mom smoking cigarettes or going through trauma during pregnancy. These variables have been shown to increase the risk of migraine in that child, even as they get older into adulthood. Tons of research shows childhood trauma, the adverse childhood experiences, does relate to more migraine. We've done a couple talks on that in the past, Sandra, I believe.
Yeah.
So basically, the more trauma that child had before the age of 18, and those traumas went unaddressed, unmanaged, untreated, that person may be way more likely to have a history of migraine. This is a great article I often cite in talks when I give on this, but why do you want to care about adverse childhood experiences? The more trauma that happened to that child as he or she gets older, when they become adults, they could be dealing with more headaches. They may be more prone to developing diabetes in some cases. It can be a factor with memory issues, kidney problems, chronic pain, mood disturbances. It is so important to have an appreciation for childhood trauma. Even if you work with only adults, what happened to your adult client several decades prior may explain why they're having a lot of issues in adulthood. Just another study, again, study after study. This is from last year, another study, childhood trauma is a risk factor for future migraines. More studies here, just showing you here, childhood trauma can play a role in contributing to poor physical health outcomes in adulthood. May drive the bus with more arthritis, digestive health issues, problems with the heart, problems with our muscles and skeletal system. And this isn't even including prenatal exposure to chemicals, drugs, alcohol. Emotional abuse is a driver for more migraine. Poor attachment patterns. So when we're talking lots of trauma, adversity, hardship, neglect, oftentimes we're talking about more fractured attachment patterns. Problems with attachment have been linked with more migraines as well.
Wow.
So insecure attachment patterns, very common in our general population. It's even more common when we're talking about prenatal adversity and adversity early on in life.
Sandra Flack, host of the Adoption and Foster Care Journey podcast, and FASD educator Debbie Raymond invite you to join Hope for the FASD Journey, a virtual support community for parents and caregivers raising individuals with fetal alcohol spectrum disorder, diagnosed or not. This faith-based support community meets online 3 times each month, features special VIP guests, and a private Facebook group for members only, which includes Soul Care Saturday video devotionals led by Sandra and Deb. Both Sandra and Deb are adoptive moms raising kids with FASD and facilitators of the Facets Neurobehavioral Model. For details and to register, visit justicefororphansny.org/hope-community. That's justicefororphansny.org/hope-community.
Yeah, I'm amazed at how, probable or possible it is that our children, the audience that listens to this podcast, adoptive and foster parents, our kids fit into a lot of these categories with the adverse childhood experiences. So migraine, I guess, is something that hadn't really crossed my mind as something to be on the lookout for, that could be a symptom. But I do know, and I know at the beginning you talked about, a migraine would be 15 times per month, or maybe I misunderstood that. But Dr. Brown, can somebody have an occasional migraine, or is it not a migraine unless there's that pattern? And the reason I ask is because, for example, one of my sons just the other day, and he's been under stress at work. He came home. He seemed totally fine. He seemed fine. He works nights. And then he was home for about a half an hour and then came in and said that he threw up. So that I'm like, do you have a fever? Do you have a stomach, virus, that kind of thing? Which none of that was the case. And then, the next morning he got up and he was famished. He was hungry. And as I was talking with him, and he has FASD, he was able to kind of back up and explain and tell me he had a headache at work. And then, but he didn't say anything to anybody. He didn't think to, take, some, headache medication to try to calm that down. So I know over time personally myself, if I have a migraine or a headache that's unaddressed, I can become, nauseous and then end up throwing up. And then, he was fine after that. So would that be considered a migraine, or is that a headache brought on by stress? Is there a difference?
Yeah, I don't know what it would be classified as. Here's where it gets very complicated. I believe currently there's well over 200 different types of headache disorders out there. There are
Wow.
all kinds of subtypes. And remember, a headache is not always like when people have a headache, that's not necessarily always a migraine. There might be a primary headache disorder. You could have secondary headache disorders. There's so many subtypes. So what I would say is find a doctor who's a headache specialist. Get an accurate diagnosis if a diagnosis fits. Maybe it's situational again and it's caused by stress or meal skipping or something like that, or it's co-occurring with something else. There's post-traumatic headaches where that might be more common after like a headache or after like a head injury or concussion, things of that nature. There's something called like medication overuse kinds of headaches as well that could be triggered by certain kinds of medications that might be overused for a prolonged period of time. So in that case, I don't know what it'd be classified as because I'm not here to diagnose, but
Right,
I would
right.
say, yeah, definitely talk to a doctor if these things are there. It doesn't hurt to consult because maybe it is a full-blown disorder. Maybe it's not a disorder, but it's just situational. And if you work with someone to eat better, get better sleep, reduce screen time exposure, exercise more, reduce stress, that might clear it up in some cases. But it does get more complicated when we're talking prenatal origins too. So like
Yes,
FASD, there's a prenatal component, which there's not a lot of specialists out there that probably have the expertise in FASD and headaches, but
right.
there might be. I just never come across one.
Yeah. And the other thing I suspect with him is dehydration because he's working in a hot kitchen. He's a dishwasher. And again, with the FASD, although, we tell him you need to drink water while you're working, and his boss tells him you need to drink water while you're working, that doesn't necessarily mean he's going to drink the water while he's working, right? So, it could have been from that, I'm thinking, because I'm not picking up that there's a pattern of headaches with him. But this is definitely opening my eyes to that. And then kind of on a different, different question would be the aura. Now, I personally have experienced auras prior to having a migraine. So does every migraine, is every migraine preceded by an aura, or is only some? How does the aura play in?
Everybody's going to be different, and
Okay.
it doesn't go in that nice order I showed you on those slides. So it can absolutely be different with different people. And I hate again to give medical advice here.
Right.
When you look at diagnostic criterias, we know there's nuances to that, and that is where a qualified medical doctor would come into play. Because you can have an aura without a headache, which
Mhm.
sometimes it's called like a silent migraine as well. So that's another variation to be aware of, which gets even more complicated. But typically, when we're talking the aura symptoms, again, you're gonna probably have some more sensory issues and flashing lights and things like that. Maybe it's tingling in the face or hands. And again, everyone's different because when we're talking the prenatal stuff too, that's where it gets a little more tricky. Because in the FASD literature, I have never come across a peer-reviewed journal article that specifically examined migraine and FASD. There's a couple mentions in passing in the FASD literature that just basically says, yes, migraines are common in this population. So we need researchers to really focus. What are the prevalence of migraines in FASD? How does an FASD migraine differ? What are the nuances there compared to the general population? I'm just not aware of data out there on that yet. So post-traumatic stress disorder, anger control problems. If you work with folks with these things, maybe migraine is higher in some cases. PTSD and migraine do share some common risk factors. Not everybody with PTSD is going to have migraine. Not everyone with migraine is going to have PTSD, but they do co-occur.
Hmm.
This next section is all about like implementation. I'm a big fan of the biopsychosocial model, which is very holistic, teaches qualified professionals to really appreciate biological, psychological, and social factors. So if you're a professional listening to this, learn about the biopsychosocial model. This research also does say if you really want to address migraine, work with your qualified healthcare provider and really address some of those comorbidities as well. So it's not just tackling the migraine, but if that person has other comorbidities like a gut health issue or a sleep problem or a feeding issue, got to address that as well. So this might go to your question, Sandra. There's a million triggers out there for migraine: missing a meal, bright lights, loud noises, alcohol, smoking consumption, overusing caffeine or quitting caffeine, oversleeping, undersleeping, exercising too much, not exercising enough, taking too many migraine drugs for a long period of time, changes in the weather, hormonal factors. There's some interesting research that does show having a migraine can adversely impact executive function capabilities. We know everybody with FASD is going to have executive function deficits on some level. Probably just makes it even more intense.
Hmm.
We talked about attachment issues that can play a role in migraine, the person's stress level. How do they cope? Do they have very poor coping skills? That can be a factor. And social support status could be a factor. Not having any family, friends can be a factor as well. Excessive screen time exposure can contribute to more headaches in children with migraine with aura, this study found. So reducing screen time exposure
Mhm.
is a no-brainer. Excessive screen time exposure is not good for human health. We've talked about alexithymia many times. This is very common in your kids, I'm sure. This is emotional blindness, problems naming, labeling emotions. This is more common in folks with migraine. Chronic sleep issues. Sleep's number one to health, in my opinion. Most people with FASD have sleep issues. A very high percentage of kids with autism, ADHD, attachment issues have sleep issues. Stigma is talked about in this research literature, something called migraine related stigma. The more we can address these things, name it, label it, reduce the stigma, that is going to be helpful as well. I'm not giving dietary advice here. Work with a nutritionist dietitian. But some of the dietary triggers in this literature are lots of alcohol. Sandra, you mentioned this. So that's basically not getting enough water, dehydration, having too many nitrates, aspartame, like in diet soda, MSG. If you go to like buffets, you're getting a lot of MSG. These are migraine triggers, the research says. Food insecurity. I believe we did a talk on this previously too. A lot of kids that are living in poverty, homelessness, of course, lots of childhood trauma, may actually have dealt with food insecurity as well, which is a type of trauma. Food insecurity, according to literature, has been associated with possibly triggering more migraines as well. Why does food insecurity potentially trigger migraines? Meal skipping, blood sugar imbalances. Being food insecure puts more stress on the family system. And when you're food insecure, you're not eating healthy foods. You're eating probably a lot of junk food, processed foods. Here's another variable you don't think about. Maybe somebody lives in a home and there's been a lot of water damage. Maybe they live in an old home and there's a lot of mold exposure. Well, mold exposure in a home can trigger more migraine, insomnia, all kinds of things. Migraine just doesn't impact the individual. It impacts the entire family system. This is a good reminder. We need to consider the entire family system. Sorry, Sandra, going so fast. Any thoughts on that last section before we get to part 3 today?
No, this is, I mean, it makes a lot of sense to me and it lines up with a lot of things that we've already, discussed in the past. And that was really, I know you're going to be going into tips and strategies here, and that was going to be really my question. Like, as parents and caregivers, what do we do if we suspect that our child may be having migraines, or, we realize that they're more vulnerable to them? What do parents do?
Become informed, work with the healthcare provider first. I have a certification in lifestyle medicine. I love lifestyle medicine. And lifestyle medicine approaches are very common sense. These are the 6 pillars of lifestyle medicine. Get better sleep, exercise more, reduce your stress, eat better foods, try to avoid alcohol, tobacco products, and develop healthier relationships with other people. Lifestyle medicine has been talked about within the context of all kinds of conditions, including it can be very helpful to manage migraines. Trauma-informed care approaches are talked about in this literature because migraines can be traumatic. And if you are an adoptive parent and you adopted a child out of the child welfare arena, I hate to say it, that child did come out of a traumatic situation. Maybe the child doesn't remember it in their memory, but they're probably holding on to it in their body. In the migraine literature, it talks about having a trauma-informed care lens. Really appreciate trauma, how that impacts the individual. Understand attachment theory. Work with providers who understand trauma-informed care, attachment theory. The more you can target trauma and fractured attachment patterns, that's going to be helpful as well. In this research literature, this comes out of the pain neuroscience literature. It's something called neuroscience education therapy. It's been talked about for a good intervention to target migraine. So this would be something maybe you want to work with a pain specialist on. Maybe you're working with a mental health provider who has an appreciation for these topics. Well, a mental health provider who understands migraine can teach that client more effective, healthy coping strategies. So if that client has a tendency to smoke cigarettes and get very rageful, use drugs and alcohol, stress eating, helping them move away from those unhealthy coping strategies and maybe move in that lifestyle medicine area. Helping the client understand their triggers. Every client that has a migraine is going to have different triggers. Helping that client become more self-aware to avoid those triggers in the future. And that mental health provider could teach skills to that client on ways to live a healthier life. Working with a mental health provider, again, who understands this stuff, maybe that provider has a great appreciation and training for cognitive behavioral therapy. And there's some good studies out there that shows integrative approaches to cognitive behavioral therapy can be effective in helping adults. This is an adult study, but this can be used with younger individuals too, to reduce migraine intensity. And CBT approaches are great for teaching the client education, helping the client cope more effectively around their fear of future attacks, lifestyle counseling, which is teaching that client healthier lifestyle practices, teaching the client better stress management strategies, and again, trigger management. Work with a dietitian nutritionist, but there's good research that does show if you eat the Mediterranean diet, that might be very helpful in addressing migraine. I'm not saying it's going to cure it. Mediterranean diet, you're getting rid of processed foods. You're not eating junk food. You're staying away from sugar sweetened beverages. You're eating more natural, healthy foods, lots of fruits, vegetables, lots of olive oil. You're trying to stay away from red meat as much as possible, more fish, things like that. Managing blood sugar levels is so important. So if you know somebody goes to the buffet and has 6 plates of food, their blood sugar levels are all over the map. If you know somebody that never has breakfast, their blood sugar levels are dipping. So really have an appreciation for managing blood sugar levels. Working with an exercise specialist who understands these topics. And there are some studies that show yoga, Tai Chi, resistance training, relaxation techniques can be very helpful. It does get nuanced because over-exercising can trigger migraines. Under-exercising can trigger migraines. Exercising too much and not replenishing your body with the right amount of sodium and electrolytes is a problem as well. So working with providers who understand these topics. Art therapist can play a role here. We don't think about art therapists in this, but we have studies out there that do show art therapy can be helpful for people with migraines. Online digital interventions can be helpful. There's tons of studies. I literally have 500 plus slides developed on this stuff. I had to cut out so much. Teaching people how to have greater self-management is a great thing for migraine management. And there's digital tools to teach us too. So what would be self-management? Well, we all can do better with this probably. Well, self-management would be, I need to get to bed by 10 tonight, but right before I go to bed, oh, I see there's a good movie on. Do I decide to watch the movie and stay up till midnight, or do I have good self-management and go to bed at 10? Do I wake up in the middle of the night and go to the refrigerator and have a piece of cake? Or do I wake up in the middle of the night and just calm my mind, go for a little walk, do some deep breathing if you have insomnia? Those are just examples of self-management. Here's this is a great article that talks about acceptance and commitment training plus migraine education workshop can be done in a 1-day intervention that might help people deal with depression and migraine more effectively. So there's just so many different interventions out there. Here's another intervention. It's called the Be Home Kids program. It's a 6-session mindfulness-based practice where they use general education, lifestyle practices, things of that nature, and they teach kids the education around these things. There's mobile health apps, working with providers who understand these things. So it doesn't just have to be face-to-face. And then this would be another thing you'd want to be aware of. I think it complements the lifestyle medicine stuff really well, but it's called Life's Essential 8. You can find it on the American Heart Association's website. I love this. I always try to weave this in a lot of talks I do, not just with migraine. It's very common sense. And this was originally developed for cardiovascular health and things of that nature. But there's research that does show if people engage in life's essential 8, it may help reduce migraine intensity. You're asking yourself, well, what is life's essential 8? Well, this is what it is. Working on managing cholesterol levels, managing weight, so somebody's overweight or underweight, somebody has high blood pressure, managing that more effectively, moving more, reducing sedentary behaviors, having an appreciation for blood sugar imbalances, working with providers and getting a good dietary plan in place, quitting smoking, and really honing in on good sleep. That's life's essential 8. Sandra, I wish we had more time, but that hopefully is a good starting point for all of you folks. Let me know if you have questions. Sandra, I'll stick around. Any thoughts? Here's my email address, folks, too. And I have tons of literature and resources on these topics.
Yeah, so Dr. Brown's email address, if you're not looking at the slides, it is Jerrod, Jerrod 01234 Brown at live.com, and we will put that in the show notes as well. Jerrod, I think you always bring a wealth of information, and it's eye-opening, it's educational. But a lot of times, it can seem like a lot, right? And technical stuff sometimes, but you do bring it down to just those basic things all the time that I believe parents can pay better attention to. And that is the importance of sleep, the importance of nutrition, the importance of exercise, getting off of those screens. You talked about the paying attention to blood sugar levels, paying attention to make sure that, there's not the smoking or the, alcohol consumption and things like that. And it's that all around healthy lifestyle that will improve outcomes, certainly. And then, of course, if parents are suspecting maybe migraines, maybe their child, maybe that's a thing with them, they want to seek out their medical provider and look into this. But I know you've just brought incredible knowledge to us again today, and things for us to be looking out for. And we always appreciate your wisdom on this and every topic you bring to us.
Sandra, I so appreciate that. Thank you, and really honored to be back here. And thanks, folks. Hope you found this helpful. Yeah, it can be a lot, but education, I feel, is powerful. We got to know these things to make choices and decisions on how to live a healthier lifestyle. And again, migraine, not going to be a factor in everyone's situation, but it's probably going to be a factor in a lot of your households on some level, I would assume.
Yeah, and so important to be aware of it. It might not be the first thing that we're thinking about when we're dealing with those big behaviors, but it's definitely something to be aware of and look into, because it also could be driving some of those big behaviors.
Okay. Well, thank you, Sandra. I really appreciate you.
Thank you so much. We appreciate you, Dr. Brown. We can't wait to have you back on again soon.
Thank you, my friend.
Thank you. And thank you for listening to this episode with Dr. Jerrod Brown. Just so much invaluable information there. He always goes deep in the weeds on any topic that we talk about here on the podcast with him. Again, you will want to check out his slides, so you can go to the Justice for Orphans YouTube channel, where you can watch this and any of our podcast episodes. You can watch the video version, and Dr. Brown does share slides so that you can, if you want to see those slides and listen again, if you just listened the first time through the audio, if this really resonated with you, you can watch the podcast and see his slides. And if you really have more questions for him and you want to, contact him directly, we will again put his email address in the show notes. But it is super simple, Jerrod 01234 Brown at alive.net. And so that you can reach out to him. He makes himself available, which is wonderful. And thank you for listening to this episode of the Adoption and Foster Care Journey. Please be sure to subscribe to this podcast, follow it, leave a review. We always greatly appreciate those, and share this podcast with your fellow foster and adoption friends so that they can be encouraged and equipped as well. And be sure to check out our resources at justicefororphansny.org. Just click on the Adoption and Foster Care Journey, and you will find all of our FASD resources, from the parent coaching to our Hope for the FASD Journey online support community, a link to my blog where I blog monthly, just lots of great information, our online workshops and in-person scheduling, all of that. Feel free to check us out. We're also on social media. Follow our Adoption and Foster Care Journey pages on Instagram and Facebook. Love connecting with you there and everywhere. I'm so grateful that you spent your valuable time with us today. I'm thrilled to have you along for the journey.
Thank you for listening to this episode of the Adoption and Foster Care Journey podcast, brought to you by Justice for Orphans. We hope you were encouraged today. Please be sure to subscribe to this podcast and leave a review, and share it with your fellow foster and adoptive parent friends so they can be encouraged too. Be sure to find and follow us on Facebook and Instagram at Justice for Orphans, and check out our website for vital resources at justicefororphansny.org.